Thank you very much for this opportunity. I think I will first use this opportunity to thank the Medical Physics Association for deeming it fit to invite us. Well, me in particular, but I see it more from the point of the commission because our job is to promote the peaceful uses of nuclear science and technology, which this opportunity provides. So I want to express our appreciation. The title of my presentation is the role of the International Atomic Energy Agency, that's the IAEA, in enhancing modern medical physics practice in Nigeria. That's the title. Next slide, please. Well, essentially, I try to depict this picture most times when I make presentation, particularly if it's a presentation that has to do with the IAEA. Because over time, from my engagement with the IAEA, I've seen that most activities within the context of nuclear science and technology have some tools that will support the work you do at your organization, your institution, projects and programs. But unfortunately, we have opportunity to visit the IAEA website where there are a lot of tools. We have a lot of tools, but if you do not know how to source for these tools, you may have everything you need within the framework of the IAEA, but you'll still not be able to achieve much. So that's a picture of somebody having over 20 ladders, but because he's not able to make proper use of these tools that he has, he still has not been able to achieve anything with all the tools he has. Next slide. Now, I see that and then I relate it with this and then look at it as something for us to think about. Just like I explained, IAEA has several resources, they have several tools, literatures, materials within the framework of our discussion today, that is medical physics. But unfortunately, not all people are aware of some of these opportunities, some of these materials that ordinarily should help and support their aspirations and goals in terms of pursuing an effective and impactful career in the area of medical physics. So I think this presentation will afford us the opportunity to see some of these opportunities that are abound in the IAEA and even within the context of the Nigerian Atomic Energy Commission, where I work as the National Liaison Assistant for IAEA in Nigeria. Next slide, please. Now I looked at what exactly is our role as a commission, the Nigeria Atomic Energy Commission. Apart from other activities that we do, essentially our role is to promote the peaceful uses of nuclear science and technology. How can Nigeria benefit from the applications of nuclear science and technology? We know there are several areas where nuclear has impact. Nuclear can be applied to support our socioeconomic development in different areas. One is in the area of food and agriculture. We have also in the area of human health, then in the area of science and industry, water resources, environment, energy, and a lot of other smaller areas. But looking at the bigger picture, these are most of the areas that we can actually deploy nuclear science and technology for our socioeconomic development. Next slide, please. Now, our focus for today's presentation is in the area of human health, that is medical physics. Now, I've said a key area where my commission, that's the Nigeria Atomic Energy Commission, has done some extensive engagement with the IAEA is in the area of human health, and of course, different sectors of the broad human health area: nuclear medicine, radiation oncology, radiopharmacy, medical physics, oncology nursing, and a lot of other areas in the health sector where ionizing radiation is utilized to help in addressing health challenges. Next slide. Now, I put this slide to just give us an idea of what medical physics is. Unfortunately for me, I'm not a medical physicist, but having worked closely with renowned medical physicists, I have been able to understand what a medical physicist is actually supposed to do. Essentially, it's that branch of oncology medicine that utilizes the knowledge of physics and medicine, particularly in addressing human health. Next slide. What do medical physicists do? As I've said, having been around medical physicists for several years, I've been able to understand that these are highly trained personnel that are expected to provide expertise when it comes to diagnosis and treatment of some serious health conditions like cancer and cardiovascular diseases using high-end equipment within the oncology space. Now, behind the utilization of these machines, as I've said, we have professionals, highly skilled people that utilize the knowledge of radiation science to ensure that patients and even the medical personnel and caregivers are well protected from the activities of this equipment and procedures. Next slide, please. Now, we have medical physicists in the country, and I'm sure that's why, because of the number, they're able to form a formidable association that has been impacting on the lives of our people. But even with the number that we have from available records, even Africa-wide, the medical physicists we have are still grossly inadequate to support our medical healthcare system and facilities. Of course, not only narrowing it down, even in Nigeria, we still have gross inadequacy of medical physicists because of the skill and knowledge required to practice such a profession. Next slide. Now, what do you need in terms of knowledge acquisition to be a medical physicist? This I'm only providing particularly for those that may not be medical physicists or those who do not have some understanding of this specialized area, but are also part of this webinar. As I said, to be a medical physicist, you need to have an in-depth knowledge of both the human body and physics principles and how to apply these principles for diagnosing and treating patients in our healthcare facilities using high-end medical physics equipment and facilities. Next slide, please. Now, we're talking about the IAEA. Some people may want to really understand what is this IAEA, but I know from this space of our webinar, most of our participants are familiar with what the IAEA is. That's the International Atomic Energy Agency that is based in Vienna. It's actually a center of cooperation in the nuclear field that ensures member states have access to the peaceful uses of nuclear science and technology while ensuring safety and security of nuclear facilities and operations. It was actually established in 1957 within the framework of the United Nations system, even though it's a specialized body under the United Nations system, but it's not a wholly owned United Nations institution. Next slide. Now, what is the IAEA doing? Now, within the framework of what we do in Nigeria, we have been able to establish a technical cooperation with the IAEA, which can be traced back to the 60s when Nigeria joined the IAEA. We have seen the immense benefits and then what we can get in terms of facilities, in terms of projects, in terms of capacity development. So that's why we established that relationship. Now, within this framework of the technical cooperation that we have with the IAEA, Nigeria has implemented several projects and activities and carried out coordinated research projects in the area of medical physics that are aimed at properly placing the medical physics practice within the country and helping us again in the implementation of our medical physics activities within the healthcare. Next slide, please. So the framework of our technical cooperation with the IAEA is actually hinged on a document that is called Country Program Framework, which we have been working on. It lasts usually for 5 to 6 year cycle, each country program framework. The most recent one was signed last year during the IAEA General Conference. That's for Nigeria, and that is the 4th country program framework that we signed with the IAEA, which is supposed to last till 2029. Within this document, we have built in issues, we have identified gaps in the area of socioeconomic development where nuclear can play a role. And then we are religiously following this document because whatever you want to do with the IAEA within the framework of the technical cooperation has to be an item contained in the country program framework. As long as it's not embedded within the country program framework, it's usually difficult to extract and implement, just like our projects. Go on to the next slide. Now, these are some of the benefits we get as partners of the IAEA, as member states. Of course, Nigeria is a member state of the IAEA. By virtue of Nigeria or a country being a member state of the IAEA, it gives you a recognition, global recognition as a contributor and a partner to the International Atomic Energy Agency. If not for anything, that recognition is something. It also provides opportunity for member states to develop their capacities, to share resources, have access to knowledge, expertise, and technology, and even facilities. It also helps member states to enhance their capacity through participation at various IAEA events and programs. And then it helps in creating a platform for networking to share safety knowledge and concerns, and then help in addressing some of these concerns. And then there are a lot of publications from the IAEA that member states can also use to learn about the implementation of various activities, to learn about certain projects and programs where nuclear has comparative advantage over some other areas. And then it also enables member states to use the nuclear technology in the attainment of the overall sustainable development goals within their countries. Next slide. Now, what's the IAEA's role in medical physics training in particular? Well, I know again that there are several training programs in different areas of human health and in the area of medical physics. IAEA works with member states to arrange for programs that will meet the needs of member states, giving them opportunity to learn about modern medical physics practice, share ideas that will enable member states to actually work better and then be more impactful. IAEA also supports long-term training opportunities by representation of member states. They help in arranging long-term fellowships, a lot of programs that member states can send their participants to attend and benefit from. The IAEA also provides opportunity of procuring equipment that will support high-end equipment that will support medical physics practice, knowledge transfer within the medical physics space, and a lot of other opportunities. Next slide. Well, I'm trying to show some of the activities as a commission that we've done. This is a letter which was written to the IAEA when we saw that there were opportunities for Nigerians. We now sent a request letter to the IAEA from the Nigeria Atomic Energy Commission asking that Nigeria is interested in this project, and glad to inform us that IAEA eventually approved our participation. We have 3 components to that project: radiopharmacy, medical physics, and radiology. I think the medical physicist that has been representing Nigeria on this is one John Engr Awwal. Next slide. This is just to give you an idea of some of the promotional things we do leading to participation in projects and programs of the IAEA. Short of some of the projects and activities that the IAEA is doing and that Nigeria is participating in within the TENCA cooperation we have with the IAEA. We have projects that can come either from the regional context. We have projects that can come from the interregional context. Where you see regional, these are projects involving a number of countries within Africa. That's RAF. If you see interregional INT, these are projects that Nigeria is participating in within the context of interregional. You have representation from Africa and then some other regions of the globe. And then you have national projects. National projects, which are NIR, NIR, are projects that are meant specifically for Nigeria. And that's the code for Nigeria, NIR. So we have, for instance, we have participated in this project, RAF 6048, which is a project established to strengthen medical physicist capabilities that will ensure safety in medical imaging with an emphasis on pediatric imaging safety. These are some of the programs we do with the IAEA. I'm giving out this snapshot so that people will know some of the activities and begin to think on how they can equally participate and benefit from some of these opportunities that are several within the TENCA Corporation of Nigeria with the IAEA. Then we have RAF 6053, which is enhancing capacity building of medical physicists to improve safety and effectiveness of medical imaging. Then we have another project, RAF 6055, which is on improving the quality of radiotherapy and the treatment of frequently occurring cancers. We have RAF 6058, which is on strengthening the capacities of radiopharmacy and medical physics and radiology for expansion and sustainability of medical imaging services, which is the second phase of this project. And then we have another recent project which started this year, that is RAF 6060, being managed under the Nigerian Institute for Cancer Research and Treatment, which is on enhancing member states' capacities for improved cancer diagnosis and treatment. There are also opportunities for fellowships. Currently, even though this is in nuclear medicine, we have a number of Nigerians that are undergoing. In fact, one just finished, and she's about returning a 3 to 4 year fellowship in the area of nuclear medicine in South Africa. One recently went. We have a number of them that are undergoing fellowships in radiopharmacy, also in South Africa. We have oncology nurses that are undergoing fellowships, master's fellowship in Rwanda, and a lot of other activities that people have undertaken, and some are still undertaken and would be undertaken by people. So these are opportunities that we have within the structure of the IAEA and the support that the IAEA has been giving to Nigeria over the years as a form of promotion and providing information for people to take advantage of. And then, of course, during the International Day of Medical Physics, which is a day that has been set aside by the global community, that's November 7th, IAEA also organizes programs and events to help in raising awareness about the role of medical physics, the importance of a medical physicist in the overall healthcare management continuum. Next slide, please. Now, this is also an invitation of a virtual event, regional training course on clinical training programs in medical physics. This is just an example. There are several training opportunities that are there within the IAEA space that people can look at, people can benefit from, especially for those that are registered with the InTouch platform, which gives you an idea of the training programs and opportunities that are there that you can actually utilize as a medical physicist. Because we've seen that, within the country, we may not have adequate infrastructure providing training for medical physicists, particularly because of the importance and then the requirement of this very important area of medicine. So we've been relying so much on IAEA, but I know again that efforts are ongoing to ensure that we find a way to develop curriculum in a way that some of these training programs can be done locally. But as it is, we still rely heavily on external support. But I also know we are doing our own bits and pieces within the country to ensure that we reduce over-reliance on external training for medical physicists. Next slide, please. Now, this is a recent project that we worked on based on a number of submissions from different government institutions. I don't know if you can see this, but I just picked this because this is focused on capacity development of medical physicists and some other areas. And what we are trying to do is we want to work on this project, see how we can develop it and get it accepted and approved by the IAEA for implementation in Nigeria as a NIR project, that is national project, that will continue to help our medical physicists in addressing their skill and capacity development needs. So that's why we came up with this project. We're already discussing with the IAEA. We have gone a number of steps, done some adjustments, and IAEA is looking at it. And I'm glad to also report that some members of the association, the Nigerian Association of Medical Physicists, also some of them are involved in the development of this project, which is supposed to start January 2026 and then to last for 2 years to December 2027, because already we have some other ongoing projects. Next slide. Okay, this is under the IAEA Program Cycle Management Framework, which is a secured website of the IAEA that gives only authorized users opportunity to look at. These are just the developmental processes and activities that we are already doing, working with the IAEA to perfect this project in a way that it will be impactful and it will help us in terms of capacity development, skill acquisition, and other areas, including procurement of high-end medical physics equipment. Next slide, please. Now, there's also another very important opportunity which because within the framework of the technical cooperation that Nigeria has with the IAEA, there is no provision for support to carry out research, which is an important element of development, particularly in the medical physics practice. You need to carry out research to get people involved in different activities so that you can perfect and continue to improve on the way the medical physics is practiced and some of the ways that treatment, diagnosis and treatment are approached. So there's a research component which, as I've said, cannot come under the technical cooperation arrangement. So there's IAEA coordinated research opportunity, which gives our scientists and of course our medical physicians or physicists the opportunity to carry out research that are tailored towards medical physics practice in the country. And this can be supported under this coordinated research project, CRP, which is on the IAEA website. You can also go through it and look at openings. When there are openings for medical physics practice, you can easily join and then see what you can do to enhance the practice in the country. Next slide. Now, there are other training opportunities. This is a Train the Trainers event that took place some years back. But this is, as I've said, not one off. There are several. I just picked randomly some of these training programs so that we see the kind of opportunities that IAEA provides for member states like us, that's in Nigeria, at least for those that may not be conversant with some of these things. Next slide. Well, these are some of the components of the Train the Trainers workshop. I've said the IAEA has developed a series of training programs to address different needs and activities. We have clinical training of medical physicists specializing in radiation oncology. We have clinical training of medical physicists specializing in diagnostic radiology. And then we have clinical training of medical physicists specializing in nuclear medicine. So these are some of the areas where people can get this opportunity of train the trainers, come back home and see how they can build on this knowledge acquired to enhance capacity locally in these various fields. I mentioned the In Touch platform. This is also an opportunity to promote it. For those that may not be part of this In Touch platform and are medical physicists, I would like to advise that you get registered so that you have opportunity of seeing training programs both in Nigeria and mostly outside Nigeria, so that you can also improve yourself and then, of course, help the country to move forward in terms of our cancer and other diseases management system where medical physics is deployed. Next slide. Now, the IAEA has to help our medical physicists. The IAEA has developed several platforms within the IAEA website where literatures, texts, TED Docs, a lot of materials are available. Now, there's a particular section where you can also access medical physics literatures. These are the literatures for 2023. Just displayed some of the literatures. If you want to have copies of this, you need to pay a token, but you can also download this for free and then go through it. But the materials, the physical materials, are actually you can buy from Vienna, and I don't know if you have somebody going, you can easily acquire maybe for your library or for some other space that you want to provide these materials. But generally, you can have access to the soft version, and then it will help you in terms of capacity development, in terms of new knowledge in the medical physics space, and then new skills, so that at least you can enhance your capacity and be able to perform your job better. Next slide. Yeah, this is, as I've said, 2023. You can still have for several years back, but as they grow, the system grows, these materials are developed, updated. You can also have opportunity to look at the past publications. This is a document, the roles and responsibilities and education and training requirements for clinically qualified medical physicists. This is also downloadable. You can download it and read, and then to understand the roles and responsibilities, and then education and training requirements for clinically qualified medical physicists. Next slide. This is another event which preparing clinically qualified medical physicists for artificial intelligence in the medical use of radiation. Just like in most other fields where the concept of AI is being injected, so it is with the medical physics practice. There's ongoing effort and activities towards integrating artificial intelligence in terms of meeting the healthcare needs where medical physics will have a role. So now this is an IAEA training workshop. Well, I've said that the IAEA held the first ever training workshop on how to establish clinical training programs for the radiotherapy medical physicists using regional cooperation in Abuja. This took place in Abuja 2018. Several other events have taken place before this event. Several other events have also taken place after this event. But I just singled out this because of that first ever training workshop. But several other trainings, not this. But for this is the first ever in terms of workshop to establish clinical training programs for radiotherapy medical physicists using regional cooperation arrangement. That's AFRA arrangement. It took place in 2018. You can also lay your hands on the brief or briefs and maybe reports so that you know actually what took place and what you can learn as a medical physicist practicing in the country. Then I also mentioned about the, no, okay. There's also, okay, workshop held in the framework of regional technical cooperation. This is also another workshop that took place. As I've said, several workshops, events have taken place. Yeah, have taken place in the past. Next slide, please. The IAEA also has a human health campus. It's like a virtual school where you can go and have access to learning tools, several resources that will help you as health professionals. This human health campus has different activities. There's an activity under nuclear medicine, radiopharmacy, radiation oncology, medical physics, technologies, nutrition. So you can choose the flavor that interests you. And I'm sure the one that interests us here is the medical physics. And that's where you have materials, you see current developments within the medical physics space. So I urge us to take time once in a while to go through some of these platforms so that we can see how this field is evolving, current developments, at least to keep us updated as professionals and experts. Next slide, please. Yeah, as I've said, under the Human Health Campus, you have medical physics. So I don't want us to go deep into it. Now, there are also some other opportunities that you get from the IAEA in terms of opportunity for capacity development. We have clinical training guides for hospitals with residency. These are also available. The code of practice on dosimetry of small static fields used in external beam radiotherapy because this is first of its kind to be offered online. It's a program that is online. IAEA has developed a cyber learning platform for network education and training, which is CLP for net, is freely available. There are several resources to learn about health, human health, to learn about a lot of other things, but particularly for medical physics learning opportunities. These are abound within the learning platform of the IAEA. There are also webinar series that have been presented to address challenges in nuclear knowledge management, including medical physics. This you can also participate in. The reports are there, the webinar series. I also opens up opportunities for participation in some of these webinars so that people can be kept updated in the area of medical physics practice, because it's an evolving field. New ideas are coming up every day. And if you just sit in your office, you may lose track and then lose touch with some of these new developments and ideas. Next slide. Yeah, this is more like a general message talking specifically to the academia, but not only to the academia, everybody can also benefit from some of the activities of NAEC that we do with the IAEA. I mentioned about the In Touch platform, which has several learning opportunities for training, mostly outside the country. And sometimes Nigeria can decide to host some of the events of the IAEA, and that's why I said some can also take place locally. There are opportunities for our ladies in the Lisa Metna Women Program. They give you opportunity for internship outside the country in a well-established organization where nuclear science and technology is practiced, like the IAEA. You spend a number of months to learn on the job and be able to impact positively in your country on return. There's also the African Network for Education in Nuclear Science and Technology, which is the AfraNest. Nigeria also has a replica of this AfraNest, which is the NGN Nigeria Nest. It's also a network for education in nuclear science and technology that we can also look at and see some of the educational opportunities that abound. We also have the Marie Sklodowska Curie Scholarship, which provides scholarship for our young ladies that are undergoing postgraduate programs in different universities across the globe with funding support. A number of Nigerian ladies have actually benefited from this, and it's now an annual event. So I also advise, particularly our ladies, to look out for some of these opportunities. Sometimes the support can be as huge as several thousands of euros to support your program. So I think we shouldn't relent. We should take advantage of some of these opportunities. There's also opportunity to provide your information on the Talio platform. Yes, there's opportunity for job within the IEA system. There's also opportunity for to serve as resource persons for the IEA. Once you have attained certain qualification and you upload uh, your CV and other credentials on the platform. If there are events within Africa, instead of IEA bringing in experts or resource persons from outside Africa, they prefer to use local experts who will now help them in terms of delivering materials and contents as resource persons in the various events and programs that the IEA is organizing. Also, in several expert missions that the IEA will be embarking on behalf of member states. The last one is about the IEA Nucleus platform, which is the platform where you have the In Touch. I also want to keep repeating the need for all of us, particularly within this framework, to be part of this in touch platform so that we can have opportunity to attend training programs, increase our knowledge, and establish more contacts, create networks and friendship within the medical physics space. Next slide. Thank you very much for this opportunity. I still would like to say that we have been over-relying heavily because of the specialized nature of this field, medical physics, on external and international support. I still believe that we can work around some of these opportunities to build some local expertise that will help us in terms of providing educational programs and activities within our universities, maybe for a lot of other associated programs and activities. So I thank you again for the opportunity, Nigerian Association of Medical Physicists.